Hello, and how are you? Welcome to my session on the Kenya National School Health Policy Part 3. This is the last bit if you've been following on the school health policy, and we're going to focus more on the implementation model, or rather, how do we put this policy into action? If you're new here, my name is Winnie Barawa, and this is a channel where we host lectures, sessions, and expert interviews relating to healthcare. This is your area of interest. Kindly remember to subscribe and stay with me all the way to the end. So the Kenya School Health Policy Implementation Model actually adopts the devolution model that is in Kenya. So Kenya became a devolved government in 2013, and with this regard is that the implementation of this policy, which was developed in 2018, is going to adopt the county model. So in this aspect means we will have a national committee that will be working together now with the county committees to streamline all the way to the local and to the community levels. So those who've been following, we've done part one of this policy, which was introduction of this policy in terms of mission and vision, the strategies, the rationale, the goals, and all that part. And then we did part two, which was looking more into the themes that this policy focused more into, all the way from nutrition to infrastructure to pest and control, water and sanitations, name it. Now we want to see how is it being implemented. So on this structure here, we have a diagram that is showing the streamlining or how the flow of order is looking like. So we have at the topmost here, the Ministry of Education and the Ministry of Health working together in conjunction to coordinate the different committees that will implement the different roles and activities in the policy. The Ministry of Health and the Ministry of Education are working together at the topmost. They are more like the national level for this implementation model. And then as you move downward, it's followed by the National School Health Interagency Coordinating Committee. Then this trickles down to the National School Health Technical Committee. Then we have the County School Health Committee, the Sub-County Health Committee, and at the lowest level is the School Board of Management. In the School Board of Management, when it comes to the school health, there is need to incorporate the nearest health facility, whereby the facility in charge can actually sit in this Board of Management to assist with advice and guidance when it comes to development of the school by health understanding the different roles and responsibility of the chain of implementation that we have highlighted just before. So in here we are being told these roles are a joint role between Ministry of Health and the Ministry of Education. So let's start with the Ministry of Health and see what are their roles and responsibility. So the Ministry of Health has a responsibility of ensuring that there is quality control and also all treatment aspects of the school health services are adhered to. The Ministry of Health also ensures logistic management, for example, in the cases where there's need for selection, quantification, procurement, storage, distribution, and even in terms of quality controls of medication, vaccines, micronutrients and supplements or medical materials that needs to be given to the school programs. And the other bit is that the Ministry of Health provides technical advice on the required health standards, such as issues on infrastructure, water and sanitation, and other facilities in the school. And there's also aspect of advising and training in terms of changes if there's a case of change in health policy that the school needs to understand or the school health aspects need to be updated on. Other bit is provision of technical assistance on the implementation of core health and nutrition activities. So like I said, this is the topmost part of the implementation model, and so they come in more on advisory qualities or advisory responsibility and roles, and they look more on quality control, logistic management, technical advice, and also trainings. So the part of their work is mainly on the top notch and is part of supervisory as much as it also technical guide. So that's what they do more in regards to health. And the second ministry is the Ministry of Education, which again said works in conjunction with the Ministry of Health. So the responsibility of the Ministry of Education is to first ensure revision of the teacher training and the school curriculum in order to include all aspects of school health education. The Ministry of Education, number two, will guide in development and implementation of in-servicing programs on issues of health for the revised curriculum. So after developing the teacher training curriculum here, they will develop now the in-service program for the revised curriculums. And third bit is advising on changes in education policies that will be affecting the school health program. This is similar to what the Ministry of Health was doing, advising in case of changes in health policies, while Ministry of Education will advise in cases of changes in education policies that is affecting school health program. The other bit with the Ministry of Education is to ensure establishment and promotion of health clubs in school. The Ministry of Education ensures involvement of learners, communities, stakeholders in campaigns to promote health in schools and also provision of adequate and accessible infrastructure that is conforming to the required health standards. So these are key responsibilities. Again, this is top notch. It's on the national level. We are not yet in the county level at this level here. And so we are working at them as a technical advisor when it comes to these key areas. Curriculum development, policy changes and advising, promotion of school health establishment, involvement of the community and learners, and then we have adequate and accessible infrastructure according to the standards needed. So these are the inputs that the Ministry of Education brings on board. So moving on, we have the third part, and that is the National School Health Interagency Committee. So we are being informed that this committee is actually an intersectoral committee that has relevant ministry and other stakeholders that are known to be meeting semi-annually. It is the highest organ of the school health policy and brings together representatives from relevant ministries. So it has several ministries. So this committee is chaired by the cabinet secretary, that is from the Ministry of Education, and it is also it's chaired by the cabinet secretary from the Ministry of Health. So it is a committee that is co-chaired, meaning it is co-chaired by two ministries, Ministry of Health and the Ministry of Education. So this committee is responsible for policy advisory, coordination, resource mobilization, and advocacy. So who is in the committee, or rather who is in the National School Health Interagency Committee? So in here we have the Ministry of Health and the Ministry of Education, who are the co-chairs. Just like we say, this committee is co-chaired by two ministries. And then we have other relevant line ministries. We have the Council of Governors, who will be chairing education and health committees. And then we have any other developmental partners or stakeholders that have either direct or indirect impact on the school health programs in the country. And the other committee after the interagency, we have the National School Health Technical Committee. So the National School Health Technical Committee is also an intersectoral committee. It's made up of the relevant ministries and other stakeholders that meets quarterly, as opposed to the interagency that meets semi-annually. So it is the second highest organ of the school health policy after the National Interagency Committee, and it brings together representatives from different ministries. It is also co-chaired by the two principal secretaries. Here we're not talking about cabinet secretaries, we're talking about principal secretaries. So we have the principal secretary from the Ministry of Education and the principal secretary from the Ministry of Health. So who makes up the National School Health Technical Committee? So this School Health Technical Committee is made up of the Ministry of Health, Ministry of Education, other relevant ministries. We have the technical representatives such as Council of Governors, Education and Health Committee, and any other relevant stakeholders. So this School Health Committee The main agenda is to help again with coordination, resource mobilization, and advisory and advocacy. But the co-chairs here, as opposed to the interagency, it is co-chaired by the principal secretaries, not cabinet secretaries. So moving on, the responsibilities of the National School Health Technical Committee. So the National School Health Technical Committee has, number one, the responsibility of overall policy implementation of the school health program. It is also primarily responsible for strategic program oversight and decision making. It will provide strategic leadership to ensure progress towards overall goals and considering any material changes in the school health program. And then we will have the committee engaging with and provide semi-annual reports to the School Health Interagency Coordinating Committee. So the committee is supposed to receive also reports from the technical working groups and any other program steering committee, which may be formed based on the thematic areas or the need basis. So this committee is a linkage of several other technical groups, but again, the main work also it will report to the interagency committees by sending semi-annual reports and also providing strategic leadership and oversight, or rather also guiding on decision making in terms of school health programs. So it has some good roles. Most of them are oversight roles and policy implementation monitoring. But the main work is they will report to the interagency committee after they have collected reports from technical working groups or other program steering committees. Now we are moving into the county level from the national committee. So from the county, we have first the County School Health Coordinating Committee. So we are told that the County School Health Coordinating Committee is composed of the county representative of the Ministry of Health and Ministry of Education, together with any other relevant ministry at the county government and other stakeholders. So these are responsible for assisting schools to interpret policies and implement the school health policy. So this is the committee that will borrow the policy from the national level and interpret it for the county level so that they can understand it and even implement it appropriately. So the members who are part of these committees includes the county director of health and the county director of education, who will be co-chairing this committee together, and then they can bring in any relevant ministry to be part of this. So this is a co-chaired committee, but it is at the county level. And when you move from the county level, the next level in the county is the sub-county. So we have now the sub-county health coordinating committee. So the sub-county health coordinating committee is composed of the sub-county representative, the Ministry of Health and the Ministry of Education. Together they come in with other ministries, county government and other stakeholders. Also, they have the responsibility of assisting the schools to interpret the policies and implement this school health policy. So the members of this committee will be the sub-county medical officers and the sub-county director of education, who will also be co-chairing this committee together as based on their responsibility. So they will be developing their own school health programs, looking at the priorities and the priority needs of the sub-county. Most of the time we are being told that for this committee, they use the bottom-up model to just come up with this program so that it could be need-based, that is people-oriented. And from the sub-county level, we move to the lowest level that we call the School Health Secretariat, that is now the BOM or Board of Management. So this is the Secretariat of School Health Program that will perform both administrative and coordinating duties of the program activities. So the Secretariat is drawn with relevant representation, not only from the Ministry of Health and the Ministry of Education, but this is the key tool that we will work together to ensure the services or the school health programs are taking place in the schools. They are the key implementers of these school health programs. So now, being the key implementers of this school health program or policy, it therefore goes without saying that the policy is a tool for integration and reinforcement of school health as a key component of primary health care. So these are the key people that will ensure that we meet the PHC goals that we need to implement in our school environment. So responsibilities, there's ensuring that there's efficient coordination in the implementation of the school health policy. They also coordinate and provide lead in strengthening collaborations, partnerships, and networking for successful implementation of a comprehensive school health program. The Secretariat will coordinate with the National Interagency Committee, with the National Technical Committee, and the County Health Coordinating Committee, ensuring program governance and implementation. And the Secretariat will also work together with, or it will partner with the relevant stakeholders such as the government ministries, UN agencies, development partners, or non-governmental organization in order to design, deliver, and implement the comprehensive school health program. So when it comes to the BOM, they're very busy on the ground because they're the ones whose hands are getting dirty. They're the ones doing the main work, ensuring the project are implemented and running. Most of the other secretariats more come in to just evaluate, monitor, and ensure that there's adequate funding to ensure that the project are running. So the board of management or the school secretariat is literally the most active that is expected to ensure that the policy is active on the ground. So thank you so much for staying with me to the end. And if this is your area of interest, remember to subscribe, share our videos with your classmates or your community of knowledge that can actually benefit from us. So till we meet again in our next class, bye-bye.